To give you a little background as to why I wrote this article, I ended up at our church and then at the YMCA talking to some friends as to how you could bring up a facility that's been sitting idle here for the last couple months and really without any issues or any use. And is a professional cleaning company really necessary to clean? What could be done? My friends knew that I was in the cleaning and disinfecting market with pharmaceutical, um, and we wanted some guidance and some suggestions. There are many things in common with COVID-19 and Contec's expertise, and felt like we'd like to share some of that as to basic information on disinfectants and a lot of products or alternate products that are used out there. And then also about techniques for how to clean and how to disinfect, but also very importantly, what surfaces needed to be cleaned. Um, Today's discussion builds on the article, and I hope you enjoy it.
Thank you, Pierre. Now it's time to introduce today's panel. My name is Michael Myers, and I'm the Clinical Support Manager for Contec Healthcare. I've been with Contec for 22 years, and my primary role is to help sterile compounding pharmacies with the best practices for cleaning and disinfecting and maintaining their states of control. And now I'd like to introduce Stephen Leung.
Hi, my name's Steve Leong, and I've been in the professional cleaning business for just a little over 20 years. Started first with DuPont, came to Contec, and have seen environments ranging from the very critical places where pharmaceuticals and medications are worked with, all the way through to places where a lot of people walk in and out of, hospitals, institutions, office buildings and such. And I've had a chance to see a lot of how people do things, as well as some of the best practices and opportunities for improvement. I've worked with Jen Bookout, and I'd like to introduce her at this point.
Hi, my name is Jen Bookout. I'm the Regional Business Manager for the West. I come with about a little over 20 years experience, ranging anywhere from acute care to building service contractors, education, government, anywhere from the chemical side and now into the microfiber, laundry-free microfiber side of the business.
Thank you, Jen and Stephen. I'm looking forward to our conversation today. We want to remind you that we'd like to hear from you. We do have a panel of experts behind the scenes that will be answering questions on Facebook and LinkedIn. So please join the conversation there. Before we get started, just give you a brief outline of what we are going to cover today. We're going to start with some of the basic terminology you may be hear being thrown around. We'll cover the basics of COVID-19, the goals of cleaning and disinfecting. We'll talk about effective ways to clean, prioritizing which areas you're going to clean, different cleaning and disinfecting solutions, and finally, we'll talk about reducing risk through your behavior. You know, one of the things that I think gets confusing these days is we hear a lot of terms thrown around that people are doing excessive cleaning of a facility, extensive cleaning of a facility, or they're disinfecting it, or they're sanitizing it. Stephen, can you talk to me a little bit about those phrases, the difference in cleaning and sanitizing and disinfecting?
I'd be happy to, Michael. Cleaning is simply preparing a surface, and there are several reasons why people clean. People clean for appearance, people clean for safety, and much more recently, people are cleaning for confidence. So cleaning can be as simple as rearranging things or removing contamination, but one thing is certain. If you're going to sanitize or disinfect, cleaning has to happen first. Now with sanitizing, what you're trying to do is you're trying to prepare a surface or an area so that it is safer for human inhabitation or human use. Sanitizing technically only involves bacteria, doesn't really speak to viruses, but that's where disinfecting becomes very important. You'll hear the term disinfectant or EPA registered disinfectant, and now recently there's been a lot of attention given to the EPA's list N, but disinfectants basically inactivate viruses, kill bacteria, and make places completely free of these pathogens.
And we'll get into some detail when we talk about the different types of those disinfectants later in this program. Before we jump on, we do hear a lot about hand sanitizers, and there are a lot of different companies now that have gotten into the hand sanitizer business. Jen, are there any things they need to look for if they go out and try to find any of this hand sanitizer?
Absolutely. The key factor in it is the amount of alcohol in the hand sanitizer itself. It needs to be over 62% to effectively kill the viruses that we're combating today. Hand sanitizer is great, but let's always remember the best practice is actually hand washing with soap and water, and singing a simple song like Happy Birthday while you do it, or even the alphabet song, to ensure that you're actually scrubbing for a good 20 to 30 seconds and making sure that you're rinsing really well too. Also, after you get done washing, make sure to use a paper towel to dry your hands to actually remove the burden that's on your hands as well. I would avoid using a hot air dryer, as that's not going to physically remove anything, but yet blow bacteria around.
Yep, that's a fantastic point, Jen. They're just the basics of that hand hygiene. We want to talk just a minute about sort of the basics of the COVID-19 virus, and for that, I'm going to throw it to Contec's chief microbiologist, Mark Weinsick.
Okay, so the virus that actually causes this disease is called SARS-CoV-2, but the disease is COVID-19. And if we just talk a little bit about that virus, what is a virus? A lot of folks don't even recognize viruses as being living organisms because they must have a host to replicate. They use the host machinery to create new viral particles, and so they cannot reproduce on their own, and they're considered what we call obligate parasites. All that aside, viruses are kind of classified based on whether they have this envelope or this covering around the outside of the viral particle or they don't. So naked viruses just have a shell. Envelope viruses actually have a shell encased in kind of a fatty lipid membrane. And that membrane is the spikes that you see on coronavirus pictures. And that allows that virus to actually infect your cells. But the good news is that fatty membrane actually allows the virus to be killed by a lot of things. Think of it as just one more piece of machinery that you can throw a monkey wrench into. And if you disrupt even that thin outer fatty membrane, that virus can no longer infect cells. So the good news is that even though the virus is very infectious and causes some very bad disease with many in the population, once the virus is outside of your body, it's not that difficult to kill or inactivate it. In fact, even soap and water can kind of break that membrane film, like think of it as being a soap bubble, and so it can easily break that film up. But when we really want to make sure we're disinfecting potentially millions of these viral particles on the surface, we want to use a disinfectant. And we actually rank disinfectants based on how powerful they are and what kind of organisms they kill. And so you can actually see from this chart where we rank different types of organisms, and you see that envelope viruses like coronavirus are actually on the bottom of the list. They're actually the most susceptible to inactivate or kill. Some other organisms like fungi or mycobacterium that causes tuberculosis, or even bacterial spores, which are like nature's gobstoppers and cause horrible diseases like C. diff and anthrax, those are very, very difficult to kill, and you need very powerful disinfectants to sit on the surface for a long period of time, up to 10 minutes. But for coronavirus, it's not that difficult to kill it, and that's why it's important to go ahead and at least wipe and clean surfaces with something. Even if you can't get hold of official disinfectants, at least clean them with what you have available, like alcohol or soap and water.
Thank you, Mark, for giving us a better understanding of COVID-19 and sort of the mechanics of how we can go about killing that virus. We'd like to jump in. I'd like to talk with Stephen and Jen about the goals of cleaning and disinfecting. You know, these facilities sat idle, many of them in cases for several weeks, if not 2 months. So sort of the best start before you come back in is to do a risk assessment and come up with a game plan. Stephen, talk about how they go about that risk assessment and some of the tools they can use in that process.
I'd be happy to, Michael. So in the risk assessment, what somebody's trying to do is actually take a look at how the facility is used, how people will interact with the facility and with each other while they're in that building. With the risk assessment, what you're trying to do is look for ways that the occupants could be hurt. And so when we talk about COVID-19, there are a number of different ways or vectors that the disease is known to transmit. And of course, more is being learned about the disease as time goes on. And so when you look at a risk assessment, often there are several considerations that are thought through. The first one is the groups of people that are actually going to be using the facility. When you look at groups of people, you can probably categorize in most situations people into one of three groups. One would be the building management or the owners of the building, the people that are responsible for operating it. Secondly are going to be occupants of the building, regular occupants such as employees. And third, perhaps you would categorize the third group as visitors or clients that come in and out of a building. And so as you walk through the building and look at how do people interact with the building and with each other, you can notice things like surfaces that people are going to touch. Door handles, for example, are going to be surfaces that you would classify as a high-touch surface, simply meaning that a lot of people are going to touch it quite frequently. And as you walk through a building, for example, if there's a time clock, for example, where people are going to be required, employees are going to be required to clock in, how does that high-touch surface get treated so that the risk of disease transmission is minimized? When you look at a building, for example, you may see doors that have traditionally been closed. 6 months ago, it was very common for doors that closed or restricted access to a restroom or a conference room might be kept shut. But now a risk assessment notices that and may also be a situation where people are prompted to prop doors like that open, just so that people don't have to touch it as frequently. And then finally, as occupants, the infrequent occupants, visitors or clients walk in and out, how are they expected to actually interact with others in the building or perhaps the fixtures, things like furniture? So a risk assessment actually takes into consideration the way the facilities, the materials inside the facilities are going to be used, and then how do these actually need to be treated. The safety and welfare of people in buildings is really a shared responsibility. So thinking back to the three groups of people that are often found in buildings, the management, the regular occupants, and the visitors, each type of person or category of person actually has a role to play. And if you want to put it a different way, maybe it's a shared responsibility. And so the building management, for example, has the responsibility for setting up the facility to minimize the possible transmission of disease or the virus. The occupants actually partner with the owner or the facility manager to actually utilize the building and perhaps actually support that regular cleaning process. And so in some of the businesses that I've had a chance to see recently, I see people who are not traditionally in cleaning roles actually doing cleaning. Here at Contec, for example, you'll see some of the senior managers actually doing the periodic cleaning. So it's not uncommon for somebody from the C-suite or from the director level actually going in and making sure that a surface that is high touch is actually wiped down. There's signage that's put up. And actually, one of the things that's been interesting to see is how do people or the people that run the facilities make it easier for the necessary cleaning to be done right. If you take a walk around Contec's building, you'll see little spots of blue tape which mark the high-touch surfaces that need to be wiped down a lot more frequently than ever before. And I've seen in other places where people have actually taken Post-it notes, numbered them sequentially from 1 to 20 or however many high-touch areas are in that particular area. And that enables the people that are responsible for doing that more frequent cleaning to make sure they actually hit each spot. They start with spot number 1, where the Post-it note mark number 1 is actually taped down with a clear tape, and they will actually wipe that area down to make sure it's disinfected. They go to spot number 2, 3, 4, on through until on that particular checklist, all of the high-touch surfaces have been actually disinfected.
That's a good point, Stephen. And some of the other concerns that building managers will start to see and what they're trying to prep for, and it's not just buildings, it's schools, it's hospitals, it's really everywhere. You'll see that they'll have their own containers or of like a pre-saturated white. So everybody wants to be able to disinfect and clean and disinfect their own personal space, whether it be a cubicle, whether it be a cash register, or whatever that might be. You're seeing the employees bringing their own products in. You're seeing visitors come in. I know that at some of the places that I've had to travel so far, I immediately go in with my wipes to wipe down the surface because I don't know what they've used. I have no idea. So just to make myself feel better, I make sure that I'm doing it myself. I also do it before I leave, before I check out of the hotel room, just to make sure I feel like I'm doing the right thing. But that is something that we need to keep an eye on, because now we have this free thought of, hey, I need to protect myself, so I'm going to bring my disinfectant from home or my wipes from home. And so now you see a lot of employers wanting to kind of cut that down and provide that for their employees and staff.
Thank you, Jen. And that is, it is a two-way street. When we talk about these goals of cleaning, it has to be, what is sort of the goal and tasks that are given to the building management. And then as a consumer, as an individual walking in there, I have to sort of take some of those responsibilities for my own safety. You mentioned those wipes. We want to talk about the effective ways to clean. So a lot of people have been able to, if you've been lucky enough to find some sanitizing wipes or disinfectant wipes at the store. We alluded earlier to sort of those differences between cleaning and sanitizing and disinfecting from a terminology standpoint. But Stephen, in real world practice, if I've got a canister of wipes, what's the difference between cleaning with those wipes, sanitizing with them, or even disinfecting a surface with them?
That's a great question, Michael. So going back to those definitions, if you've got visible dirt and soil on a surface that's a high-touch surface, it really does need to be cleaned to where the soil's removed. And the reason for that is some disinfectants actually lose some of their effectiveness when soil is present. I was actually in this conference room preparing for this webinar, and in the process of setting up, I brought some of the alcohol wipes in, wiped the table, and noticed that there was a little bit of discoloration on the wipe, just meaning that there was some contamination on there. So I wiped again until that wipe came up clean, and by visually looking at that, I knew I had a clean surface. That surface is now ready for application of a sanitizer or disinfectant. If you use a disinfectant, you need to make sure that you use it in accordance to the label. And what the label is going to tell you is how long, for example, does that disinfectant need to stay on a surface for all of the label claims to actually be effective. In the industry, we call that dwell time, and that dwell time means if you use a product that has, let's just say, for example, a 5-minute dwell time, you keep that surface wet for 5 minutes, it's going to inactivate or kill all the viruses that are listed on that product that are applicable to that 5-minute dwell time. And so when it comes to sanitizing, again, what we're trying to do is make the surface safer or safe for human interaction. In the food service industry, it's very common for sanitizers to be used. And so in a restaurant, for example, back in the good old days when we could actually go in and sit down without any concern to eat at a McDonald's or a Chick-fil-A, for example, often those tables were sanitized with a solution that kills 99.9% of the germs, so that between customers, there was a good measure of safety. And that's what sanitizing does. It's really meant to address, from a technical standpoint, the bacteria that may be present on a surface. But what's interesting also is that in studies conducted by infection preventionists, if you don't have a disinfecting solution or a sanitizing solution, taking a paper towel that's been wet with water is going to actually remove some of the surface contamination as well as some of the bacteria that may cause harm. And so cleaning is better than not cleaning, sanitizing is better than not sanitizing, and of course, if you're really looking to protect your staff and visitors, applying a disinfectant that when you use it according to the label instructions, you're going to get killing of the bacteria that's listed on that label and inactivation of the viruses that are listed on that label when you achieve the dwell time on the label.
Jen, I wanted to ask you, there's a different strategy. Obviously, if you do have a long dwell time, and let's take a gym, for example, and you got people coming in and working out, and the dwell time for this disinfectant is 5 minutes, let's say. Realistically, you may not have 5 minutes between each person that wants to use that machine. So there's a different way you may approach cleaning and sanitizing during the day. And then at night, when the consumers are gone and it's just the staff and they have the time, you can train them for that disinfecting step.
Right. No, that's excellent. So when you're cleaning between, each patient or each patron getting on a machine or just anything in general, you often don't have that significant amount of time to achieve your dwell time. There's different disinfectants out there that can be as low as 90 seconds for a dwell time to achieve it. Those disinfectants are, right now really hard to come by with everything going on. It's really important to read those definitions and directions. So when you're cleaning in between a customer or patron or whatnot, what's important is to use a disinfectant. That's very important, but also making sure that we're achieving mechanical removal. So utilizing something like a microfiber. A microfiber, basically, they're kind of like magic fingers. They're going to pick up those little microorganisms that are living on that surface. So if you don't have the time to let the chemical sit there and dwell, and some of us live in different areas. I live in Arizona where it's very dry and hot, so it's hard to keep the surface wet. So I know by using a microfiber, I'm going to have a higher chance of achieving that removal, to remove those microorganisms as opposed to killing it. But then once the facility is shut down, so we'll say that they close for the night, then you have the EVS technicians come in and do what we would call a terminal clean or a deep clean, where they take the time to make sure that the disinfectants are staying wet for the entire dwell time, allowing that disinfectant to actually kill, then going back with the microfiber and removing it. And removing the microorganisms and the bioburden that's on there, and essentially having a deeper clean to prevent any cross-contamination or spread of any diseases or microorganisms.
Thank you, Jen, for pointing out the importance of physically wiping those surfaces. We're not only trying to kill that virus, we want to remove what that virus was living in, so we prevent that virus's buddies from coming back in the future. Stephen, one thing I see a lot being used on the news these days, Las Vegas has started reopening casinos in the last week, is they'll show an employee fogging. They'll have a handheld device and they're fogging a slot machine or a chair in front of a blackjack table. Can you talk a little bit about that technology and how it differs from just good old wiping of a surface?
I'd be happy to. And the reality of cleaning a big place like a casino is you've got a lot of area to cover and you may have a limitation on manpower. So what a fogger allows a company to do or a person to do is to actually dispense a disinfectant over a larger area pretty quickly. You'll find that there are probably 3 prevalent technologies that are used. One is electrostatic spraying, which has the ability to put an electrical charge on a droplet or particle and actually get it to wrap around, if you will, and get on the bottom side of a chair or the underside of a table, which is pretty neat. Then you've got actual foggers. But that's what fogging's really for. Several key things to keep in mind. One is look for on the back of the label of your EPA registered disinfectant a mention about fogging. There are some companies that actually recommend a specific disinfectant for their fogger or their electrostatic sprayer. That's the best one to look for because that's been tested and shown to be effective. But if there's not a pairing, if you will, between the equipment and the disinfectant, you want to make sure that the disinfectant is able to stay on the surface for the amount of time that is required, that the dwell time is achieved.
Thank you, Stephen. So those are a couple of the different ways we can go about cleaning. And now I'd like to talk about identifying those areas we have to clean. Stephen's alluded to high-touch surfaces. Sometimes we'll hear them called frequently touched surfaces. Jen, can you talk to me about what those are and sort of when you walk into a building, how do you identify what those high-touch surfaces are?
Absolutely. Sometimes I think that we don't even realize that they're high-touch surfaces, simply from a door handle to a light switch. Even when you go to sit down at your desk, pulling your chair out, your computer keyboard. Let's not forget what's always in our hand for most of us, our cell phone. So all of those are different surfaces that we might have to clean differently. But again, going back to utilizing a disinfectant, that's very important, but also making sure that you're using the mechanical friction to be able to remove it. So something like your cell phone or your computer keyboard, you don't want to spray it down with a disinfectant for fear that it could get in there and ruin it. But by utilizing the right type of fabric to clean it, like a microfiber, you're going to help lift off those microorganisms. So being able to identify those high touch areas are really, if you just stop and think as you walk into a facility, what's the first thing you do? When you walk into your home, a lot of times we don't realize that we touch the door handle, we touch the light switch, we might go into the kitchen and touch the refrigerator, the stove, the sink handle. And as we're doing that along the way, we're now transmitting and passing on all those microorganisms that we've either picked up from one high touch surface to the next.
I'd like to ask those folks at home if you've had the opportunity to do this exercise and identify your high-touch surfaces. Our experts are standing by in our question and answer panel, so jump in there for that discussion. We do want to talk about some of the solutions that people have. First, we're going to talk about some of the solutions that are generally available, and then we'll talk about solutions that are commercially available. Jen, can you talk to us through some of these generally available solutions? Would they be effective against COVID-19?
So malt vinegar has been shown that about a 10% vinegar is effective in disinfecting a surface. However, white vinegar, which is most commonly used in our kitchens, is not at all. There's different types of alcohol that are also effective, isopropyl, ethanol. What's important is the percentage of the alcohol in which you need to achieve the disinfecting piece of that. So if it's a low low rate percentage, it's not going to achieve the disinfecting process. Of course, there's always bleach. Keep in mind that these chemicals also have an expiration date. Once a chemical is open, it will expire, so keep in mind. So with bleach, there's pros and cons. Although it's readily available, it seems to be coming back on the shelves pretty frequently. We need to be careful because bleach can actually damage a lot of the surfaces. You also need to refer to the CDC guidelines if you're going to make your own bleach and water solution, but it does offer a good disinfectant rate. There's also hydrogen peroxide. Again, the 3% that you usually find in the stores, and it's probably in your bathroom cabinet, that's been proven to kill germs too. But just like bleach, it can also be damaging to a lot of different surfaces. So again, make sure that you refer to the CDC website and find out what might work best.
And you also want to be very aware about mixing any of these chemistries. You would not want to mix bleach with hydrogen peroxide, and there's lots of bad things that can happen. So be very aware, and if you do have to make up any of your own sort of disinfecting solutions, do not mix any of these available options. There are store-bought, there are commercially available disinfectants. Those are going to be increasingly difficult to find because they are being used for those critical environments, our hospitals and our first responders. But if there are different types of disinfectants out there, Steve, can you just give us a broad overview of some of the commercially available disinfectants they may find and how they'd use them?
Yes, one of the most commonly used disinfectant families or chemistry families is what people refer to as quats or quaternary ammonium compounds. You'll find quats in places like from fast food restaurants through healthcare. And what's neat about quats is they can be very, very safe at the right concentration. One challenge about quats, though, is quats have actually been hard to come by in the past couple of months. In addition to quats, you've got other chemistries such as accelerated hydrogen peroxide. Accelerated hydrogen peroxide is a pretty neat recipe in that it's a very low percentage of peroxide, but it's really, really effective and very quickly against viruses, bacteria, fungi, and other pathogens. You'll find other blends as well. We mentioned alcohol earlier, and the commercial manufacturers of disinfectants have figured out that when you blend alcohol with quats, you get faster kill times or shorter dwell times. You'll find other chemistries such as phenols, peroxyacetic acids, and others. And so there are a lot of chemistries to choose from. As Michael mentioned earlier, availability has been a bit of a challenge right now, but the key thing to look for if you're fighting COVID-19 is the product that I'm looking at listed on the EPA's List N? And that List N is actually available on the internet when you Google EPA List N.
Thank you, Stephen. And be sure whichever disinfectant you're using, you read the labels, follow all safety precautions on those disinfectants. To wrap up today, we want to talk about how you can just, in general, reduce your risk by behavior. And that's a two-way street, both on the facility you're entering, the duties that they may have, and then yourself. From a facility standpoint, we've already seen this. They're putting up plexiglass partitions at the grocery store, and we've got the dots on the floor to help us mind and be mindful of social distancing. A lot of businesses now are offering touchless payment, ways to buy the behavior that we can reduce our risk. But Stephen, I'd like you to talk for a second about what we can do as individuals when we're going into a business on ourselves to help reduce that risk.
I'd be happy to, Michael. One of the things that I've heard mentioned by a person who's actually been to a lot of the very infectious disease hotspots over the past 20 years is that if you can protect what he calls the holes in your head, you'll do a very good job of protecting yourself from COVID-19. And so the holes that he's referring to is our mouth, our nose, our eyes, and any other opening that we may have in our skin. Our skin actually provides a lot of protection, and when skin is intact, we can be exposed to COVID-19 on our skin, and by washing with hot soapy water for at least 20 seconds, we can actually remove that virus and minimize exposure. So what people can do to reduce risk is things like wear a mask. And wearing a mask can actually serve a couple of functions. One is if we don't know we're carrying the virus, we can actually protect others from getting as much exposure by minimizing the amount of viral particles that we're shedding as we talk, as we're singing, or whatever else we're doing. We can protect ourselves with a mask because what happens is if I've touched a contaminated surface and then I touch one of the holes in my head, my mouth or my nose, or if I've actually shaved and have a little nick in my skin, I can become contaminated with the virus myself, or the virus now gains a foothold into my body through that hole in my skin. And so, as Michael mentioned, using things like hand sanitizers can minimize the risk of actually having that virus active and entering my body.
And Jen, could you talk just for a minute? We had talked before about just having a plan. You don't want to wander the aisles of the grocery store aimlessly, seeing what's new and fresh this week. So you can talk about a little bit about your action plan going out into these spaces.
Right. What's important is to always protect ourselves. We live in a society where a lot of families are multi-generational. So we're not only looking at protecting ourselves, but perhaps maybe we have a couple young children and we might have our parents or our aunts and uncles that live with us. So we not only need to be careful of ourselves, but what we ourselves can bring home to them and possibly infect them. And taking just minor precautions like wearing the mask, having sanitizer on your person, at all times. When you walk into a facility, when you touch something, when you're done shopping, when you get back to your car, sanitize your hands or take a disinfectant wipe to wipe down your steering wheel or your keys. Little things like that, where a lot of these little bacteria hide and have fun on. They live there, and by taking those extra steps, we're going to reduce the risk of us becoming contaminated. And then again, just making sure that, taking care of yourself, obviously, eating healthy, getting your sleep, water, all those sort of things are going to help keep you healthy as well. But looking out in the broader sense of things and cleaning, just basic cleaning skills, basic hand hygiene are going to take care of a lot of it.
So I'd like to thank Stephen and Jen for their time today in this presentation. And as a reminder, our expert panel will be hanging out and answering questions for about a half hour after this presentation ends. So you can join that discussion on Facebook or LinkedIn. Hopefully after today, you've got a better idea what products you can use to open a facility, some of the risk assessments you can do to identify the surfaces you need to clean, and the different products that you can use to clean and disinfect them. As a reminder, Contec provides products to critical manufacturers and critical customers, and we do have resources available for that. So before we leave, I'm going to throw it back to Daniel, and he can walk us through those resources. Thank you.